Hi, my name is Chelsea, and this is my first part of my role transitions assignment video. I will start with motivations and goals. One of my motivations is to succeed and reach my full potential and push myself. I feel that going on to RN obviously does this because you're pushing yourself to further yourself in your nursing career. I also feel that being an RN has greater options than being an LPN. There's many different fields and specialties due to your advanced education and skills. I feel that this will help me reach one of my goals, which is working in maternal and women's health nursing, which is currently hard to find as an LPN. Find a position as. I also feel that all these many options will help me to better support and provide for my family, not only financially, but with more options. You may be able to find a better location due to the many different job options that you could have, and also schedule flexibility, which is, they're both very good for a family. Also, the main reason that I became a nurse in the first place is to help others and to make a difference. And I feel that becoming an RN and advancing your skill set and your knowledge and eventually your experience can only help others, or can only help you help others. Which brings us to challenge and barriers. Family constraints are a barrier for me. I have trouble balancing work, family, and school. I also have two young children who are 1 year and 2.5 years old, and they, at their age, they require a lot of attention and time and love. And as a mom, it's hard to pull yourself away to do your schoolwork and various other tasks that need to be done. Which brings me to financial constraints. And as I mentioned, I have my two young sons who have needs such as diapers and wipes and clothing, and wants such as toys and games that add to expenses. I also own a home with my fiance, and we have our mortgage as well as all the utility bills to follow. Not to mention, we're attempting to sell. So that adds another aspect to financial and also time, with attempting to fix it up and the money that goes into it and time, and also setting up for showings and whatnot. School also is not cheap, and unfortunately, at least for the semester of the abridgment, I have to pay out of pocket due to certain circumstances. Also, I had two per diem jobs, and I left Noise Health in order to focus more on my schoolwork and going back to school, which also cuts back on our finances. Lastly, fear of failure. I was in the RN program before for GCC, and I did fail out. So it always kind of sits in the back of your mind and makes you wonder, am I ready to come back? Can I do it? Am I going to make it? But I do feel like I can do it, and that's why I'm back. Plan for success. The key pieces to my plan for success are socializing with my fellow classmates. This will allow me to have a support group of people who will likely relate to me and to my situation, because we are all in the same RN program, and we also are all LPNs, and I'm sure there's a lot more that we may have in common, and we can just work with each other and help ourselves to succeed. I can also learn from their life, work, and educational experiences, which can help me with not only the RN program, but also in my future career. I may also be able to pick up on some of their studying skills and learning styles that may be superior to my own current styles and studying skills. I will also familiarize myself with the campus staff, such as academic advisement, and also the nursing building and the nursing staff. This will allow me to know where and whom to go to if I ever have an issue or questions or need assistance within my time in the RN program. And if they can't help me directly, they may be able to direct me to someone who can, and they may even be able to provide me with valuable resources that I can utilize, which will further help my success in the program. Also, setting high expectations. Setting high expectations will help you to stay motivated and to reach your goals. As mentioned earlier, reaching my full potential and succeeding is one of my motivations. Therefore, I do set quite high expectations. Unfortunately, sometimes those high expectations feed my fear of failure, but they do balance each other out, and that little fear in the back of my head pushes me to reach my high expectations. I plan to utilize and integrate my current knowledge, skills, and experience in life and nursing within the RN program, and use it as a foundation to build off of to better succeed in the program. And that brings me to time management, which is an area that I definitely struggle with. As I mentioned earlier, with balancing work, school, and family. I often procrastinate, but I have decided on a plan to help break this troubling behavior. I plan to set out a certain amount of time each day to study and do schoolwork. Also, I plan to create a priority list to get the things that are important done, and things that don't necessarily need to be done can wait till tomorrow. I will also plan around upcoming events that I'm aware of and adjust my studying time accordingly. Which brings me to practice or experience that shows transition readiness. I had a little bit of trouble with this, but I do notice an increased confidence in myself since starting at my current job. I can complete my job with little stress and much less effort as compared to starting back as a brand new LPN about 4 years ago. I've worked in various settings, be it pain management, ortho, geriatrics, bariatrics, rehabilitation, general practice, general surgery, and as a nurse in a child care facility. I've also been in the hospital setting through my prior time in the RN program, and also through my LPN program with my clinicals. And I feel that these have gained me experience that has allowed me to be prepared to continue on with the RN transition. Role confusion and blurring. I did have a nurse, I know of a few incidences of role blurring since being an LPN. And one was, I had a nurse who had a resident with a central line dressing that had fallen off, and she called down to the RN to report it, and the RN told her to change it. She respectfully declined and said that she did not feel comfortable and didn't know whether it was in her scope of practice. I did research, and I did find out that central line dressing changing and anything with central lines is not within the LPN's scope of practice. I also had nurses questioning whether they can read PPDs, because at my facility the LPNs do give and read the PPDs. I did research, and I found that LPNs can do the measurements of the Mann-Tooks test, but they cannot discern whether it is a positive or negative result. And then I myself had a resident with a tracheostomy that he had pulled the entire thing out, so I called down to report to the RN, who wanted me to place it back in, and I told her that I did not feel comfortable and I didn't know whether it was in my scope. And I did research again, and it's not within the LPN scope of practice due to the amount of assessment and intervention that's required. Personal practice or experience illustrating the differences in LPN and RN roles. As an LPN, I care for patients through providing their medications and completing their treatments, as I observe for arising signs and symptoms or complications, and no other significant changes. I gather information and report it to my charged RN. The RN then comes to assess the resident, which an LPN cannot do because it's out of their scope of practice. She does this to help determine the best plan of care and action to be taken for that particular resident. The RN also makes changes to the care plans. Also, that is not within the LPN scope of practice. The RN also does all the care for the central lines because that's also out of an LPN scope of practice. And the RNs in our facility do all of the IV care. I did research though, and also from prior education, I am aware that LPNs can administer non-medicated fluids and can replace bags of the same IV fluid, including medicated fluid, but may not initiate new or differing medicated IV fluid. They can change the IV tubing and dressing, with the exception of central lines, and can discontinue but not place without prior training peripherally inserted IV lines. LPNs may also not flush peripherally inserted IVs, with the exception of saline and heparin. LPNs can do nothing regarding a ventilated patient. However, our facility does not accept residents on ventilation. There are many tasks and skills performed by the RN within my place of employment that I'm unfortunately not aware of due to the fact that we don't work directly or closely. But I do look forward to learning all that RNs do, and I hope for success in this program. Thank you.